So I know this is hard and people will not want to watch these videos. But the reason why I think it's so important is because we don't know what it looks like to die. So when people see it in their real life, they feel traumatized because of the things that they've witnessed their loved ones going through. A part of the educational process is to actually see what it looks like. If you see what it looks like in these videos, then if you see it in your real life, you'll be better prepared. I want the dying process to feel more sacred instead of like this emergency that you have to feel panicked around. The more we see these actual images, I think the more we will understand them and the less we'll fear them. I want to lessen the fear of death and create better understanding of what it actually looks like. And I think the more you watch these videos, the more your brain can process and experience what these videos are showing you. So when it happens in your real life, which it won't be as shocking. You will understand it more. And if you can understand it more, you can have less fear and actually be present in that moment for your loved one who's dying. And this is not to desensitize you, but it's just so you can understand. You can understand what you're seeing and why it's happening and how it's affecting your loved one. Our brain will process events in our life differently if it's the first time we're seeing it or if we have already seen it and understand it. So this is a good way to help your brain see something, process it, understand it, learn about it, so you can have a different experience next time around. And of course, I will not show any of these videos without giving you a clear trigger warning that I'm about to show you the video. And just so you know, these are not my patients. I have been given these videos with written permission saying I can share them for educational purposes. Okay, so this first video that I'm going to show you, the family sent me this video saying that their grandmother died about 12 hours after this video was taken. What you're going to notice in the video is just that her mouth is open. The way she is breathing, the way she is unconscious, how she's laying in the bed looks very normal for someone who is actively dying. I can say wholeheartedly that this person is experiencing peace and is not having any pain or suffering in this moment, despite the fact that she looks like she may feel a little short of breath. You'll also notice at the very end, she takes one last gasp. Also very normal. So just on a side note, the family said that 4 days prior to this video, this patient experienced her terminal lucidity, which is the rally or the surge I talk about in my other videos, where she had a really good day. She had a burst of energy, she had a really good day, and then 4 days later, this video was taken, which she died 12 hours later. So that's very, very common for the dying patient. And also about a few weeks earlier, she had been talking to her sister who had died 30 years earlier. So this woman in this video is following the direct path, the direct progression of death and dying. So trigger warning, here is the video. Okay, so if you noticed in that video, she had oxygen in, which probably was not totally necessary, but a lot of times hospice companies will have the person on oxygen. You saw that her mouth was hanging open. That's because our muscles are so relaxed, we don't close our mouths. So we have a lot of mouth breathing. She was breathing so shallow, you could barely see her breath until the very, very end when she took that gasp, which is also all very normal. So this is a very normal and peaceful death and dying video. So the next video, we see a lot of the same thing, but you'll notice the eyes more. So this next video, you'll see her eyes are open and fixed at the ceiling. You'll notice her mouth is open again, like the last video. I think in the next video, you'll really see the changes in breathing a little better because you can see her breath more, her chest rising and falling, and you'll hear terminal secretions, which is that death rattle. So trigger warning, here is the next video. Okay, so as you saw in that last video, you could see her eyes were not blinking. Her eyes were fixed at the ceiling, which is very normal. All of this happens because our muscles are really relaxed. So we don't close our eyes, we don't close our mouth. She likely was not conscious. So although her eyes were open, she was not making eye contact. You could hear the terminal secretions, which are very normal and are not affecting the person. And you could see the changes in breathing. Now, again, all of those things look different and scary to us, but they're actually a very normal part of death and dying and are to be expected. We can tell by the way she is laying, how calm she looks, that she is not bothered by these changes. And they're actually biologically normal, and they're metabolic changes that are just happening because the body knows how to systematically shut down and die. And the less we mess with that, the better the person will feel and the more peaceful they'll die. And remember, the body is built to live and the body is built to die. And these are all of the normal built-in processes that happen when someone's dying. I think it is important that people see what actively dying, which is the last phase of life, really looks like. TV and movies have really done us a disservice by showing people giving a long, beautiful monologue, then slowly just closing their eyes and fading off to death. And that is not how it happens. Those of you who have witnessed this firsthand will agree with me that is not what it looks like. And if you aren't prepared, it can feel really scary. And what I want to do is take the fear out of it by showing you it and explaining what you're seeing. That way, when you are in this moment with your loved one, you can be present, make this moment, dare I say, a little more sacred instead of scary. One more disclaimer, this is not my patient. This is given to me by a follower of mine. I have written and verbal permission from the family to show these videos. This is purely education to help you. Before each video, I'm going to give you a trigger warning, a little explanation, and then after you watch the video, I'll come back and explain a little more about what you were seeing. So in this first video, you're going to be seeing a woman sitting up in bed, fully unconscious. I want you to listen to how her breath sounds. So you will be hearing terminal secretions or the death rattle. You'll be seeing changes in her breathing. You'll see how her mouth is gaping open and how her family is keeping her lips moist with a sponge. Perfect. It's perfect. So trigger warning, here is the video. That is the first video I'm going to show you. It's a great example of how someone looks when they're actively dying. You can see she is fully unconscious. Her mouth is open like that because the muscles it takes to close your mouth and hold it shut are relaxed. So people's mouths at the end of life will almost always be open. Her eyes are closed. You can't tell because they're blurred, but her eyes are closed, but sometimes even their eyes will be open, but they're not really there. It's also very normal for that to happen, and that's also because of muscles relaxing. Her family is keeping her comfortable. I love seeing this part because they're using that sponge, which usually has some kind of cold water or juice or something on it, to moisten the mouth. You can even put it inside your loved one's mouth to moisten their tongue. Just keep everything moist in there. They don't need to swallow it or drink it. It's just a matter of keeping everything moist. Now, what was that gurgling noise? That's the worst part. People hate it. It's called the death rattle, which I think is an awful name, but that's what we're working with. And it sounds worse than it is. At the end of life, your body is still creating moisture to keep your mouth moist. Just like you and I, it's happening to us unconsciously right now, and we will unconsciously swallow that saliva. I just did it right now. At the end of life, the saliva is being created, but the body is no longer telling itself to swallow. So it's just sitting there on the back of their tongue, and with each breath going over that saliva and their mouth being open, it's creating a gurgling noise. People really don't like it. They think their loved one's drowning on fluids. That is not happening. Some people's death rattle will be worse than others. It just depends. There are many things you can do to help with that. One, you can just let it be because it's okay. Two, you can sit them up like they sat her up. You can use sponges to try to get rid of it if you want. You can turn your loved one on their side to help it come out of their mouth. You can give medications to help dry up those secretions. All of this can be offered to you by your hospice company as well. You guys know I love the Macy catheter. So today with the Macy catheter, what I want to talk to you about is sublingual medications and when the Macy catheter will be helpful. So a lot of patients on hospice will be getting sublingual medication, which means bits of medication placed under their tongue or near their gums so that medication can be absorbed in their mouth, which is very effective most of the time. Sometimes what happens is when someone needs too much sublingual medication, it takes too long to be absorbed, so a lot of sublingual medication can be stuck in that person's mouth. Plus, add on the terminal secretions, the medication can almost make that worse. So in this case, the Macy catheter would be a great alternative. So for those of you who don't know, the Macy catheter is placed rectally, and then this part of the catheter is placed on the thigh where you can give medications to your loved one, or the nurse can give medications through here. And you know I'm a big fan of rectal medications. People always are turned off or taken back by the rectal administration of medications, but truly the rectum is super vascular and it absorbs medications really easily, really well, and it's super effective. So a lot of people would associate this with less dignity, but really once it's placed, this is where the port lies on the thigh, and you can give medication so easily and it's so effective, and you don't have to worry about too much sublingual medication not being absorbed in your loved one's mouth. So a great example of when to use this is when someone's having a lot of pain or a lot of agitation and the sublingual medication is just too much or not cutting it. The Macy catheter is a great alternative to give medications like that, one for effectiveness and two to avoid all of that sublingual medication not getting absorbed. To learn more about the Macy catheter, visit the link in the description. This next video is of the same woman. I like to show this video because it shows a clear distinction between regular breathing and end-of-life breathing. So the way she is breathing may scare you if you're not familiar with it, and you may think your loved one is suffering because they're breathing different. But the end-of-life breathing is something that will happen with everybody. And this is because there's metabolic changes going on in your body, which is causing your body to breathe different. Your loved one is fully unconscious and not experiencing any suffering because of it. If anything, your body is preparing itself and helping itself do this and shut down. How do we know they are not being disturbed by this? We can tell by how they look in bed. Once you see this video, you'll see how relaxed she looks during these changes in breathing. If she was not relaxed, her body would physically show us by moving, being restless, throwing itself up in bed. It would show us that they were not comfortable. You'll also hear a little bit of like rhythmic moaning. That can happen sometimes at the end of life, and we know they're not really in pain because it's rhythmic. It's almost like a self-soothing mechanism that some people do at the end of life. Now, if it continued for a long time, I might give medication just to be sure, but generally speaking, when it's rhythmic like that, it's usually a self-soothing mechanism. So trigger warning, here is the video. So in that video, you see, like I said, the changes in breathing. You see that she pauses a bit before she takes her next breath at times. You see that she has that rhythmic moaning like I was talking about. A lot of that is a self-soothing mechanism that the body does to help soothe ourselves. And I'm basically showing you this just so you can see the different ways someone might be breathing and how it's all very normal. Now this last video is showing her very last phases of life. This last breath that you're going to see is called agonal breathing. Agonal breathing is not a true breath. It's a reflex that all of us have, and if you're dying a natural death, which people do on hospice, you're dying from something, but you're naturally allowing the body to shut down on its own. Everyone will breathe like this, and it's a reflex, and it's kind of like the last kind of breaths your body will take, and they're probably not really actually getting any air. It's just a reflex, and it can look like, people will call it guppy breathing. When someone doesn't know what's going on, they'll say they were gasping for air. That is not what is happening. You can clearly see this woman is very, very comfortable, and she's just experiencing agonal breathing. Again, a very biological, normal, and expected part of end of life. So trigger warning, here is that video. Okay, so that is agonal breathing, a perfect example of what agonal breathing looks like. Again, none of these videos are meant to be, nor do I think they are, disturbing. People think things like this can look disturbing because they're not used to seeing it. We are shielded from the most natural part of life, and that is death. Showing these videos, helping explain what you're seeing, can help you understand that this is not something that needs to be hidden. In fact, we need to bring it into existence, show people what death and dying looks like so you can have a better experience. Losing someone is already sad enough. Then creating chaos around it because you don't understand and fear can cause traumatic moments that really don't have to be. So learning about it, educating you about it, helping you see and understand what end of life looks like can really create a different scenario for you at your loved one's end of life. So trigger warning, this is going to be a video about one of the things that can happen during the death and dying process that makes it not peaceful, at least for a little bit. This is not my patient. I've been given permission to share this video, and it's going to show you restlessness, agitation, something we call terminal agitation. This doesn't necessarily mean that they're severely in pain or they're severely suffering. This is just a way that a non-peaceful death can present itself. There's always things we can do. It usually doesn't last forever. We always can manage it, but I still want to give an example of it. So trigger warning, here is the video. So what you're seeing in that video is a woman suddenly sitting up in bed and kind of screaming or making a noise. And of course, that looks like she's in pain. If you were in that room, you'd want to be doing something about that, and including myself as a hospice nurse. Dying is a process. And depending on what you're dying from, your personality, how old you are, there's so many things that can come into play in the dying process. So the things you're seeing don't necessarily always need to be as alarming as they look. Now, as a hospice nurse, if I was in that situation, I would medicate for that. I would call that, I guess, terminal agitation or even restlessness. I would look to see, does she have to urinate? Is she constipated? Those are two big things that can make people act that way. So there's always things we can assess, and if we can't figure out why they look agitated or restless, we usually will medicate. Besides terminal agitation, there are other things you can see in a non-peaceful death. Some of those things that I usually see are severe nausea and vomiting, severe shortness of breath, severe pain, or seizures. Again, not everyone and most people really won't experience these things, at least not consistently. And what I see in people who do, it's usually in waves. So it's not like this steady flow of never stopping, just pure suffering. It's always like a long period of peacefulness and then a wave of symptoms popping up again, and we need to manage those symptoms. And it can look non-peaceful in those moments because we're managing the symptom. Now, depending on how long it takes to manage the symptom is how long this non-peaceful episode will last. A lesser known route but more effective is to give medications rectally. And the Macy catheter is a great way to facilitate that. Today's video is sponsored by the Macy catheter, which is a device that is placed rectally to help facilitate giving medications to control all of those symptoms that I was just talking about. Many people are turned off by the fact that this is placed in the rectum. However, I can tell you from firsthand experience, it's an excellent way to give medications to manage symptoms. If you want to learn more, please check out the link in my description. So as hospice care providers, there are several things we can do to help manage these symptoms to make the death more peaceful. When all else fails and we've tried all of the things and the person still does not appear to be comfortable, we can palliatively sedate them. This is something we rarely do, but it is something that can be done on hospice. The best thing I can say is there are ways to try to prevent and get ahead of the dying process to help make it more peaceful in the long run. And a lot of those things that you guys can do are things like you're already doing, which is educating yourself, knowing what death and dying looks like, talking to your loved ones, your friends, your family, all of you guys discussing how you want your end of life to be. Do you want to be in the hospital? Do you want to be at home? Do you want to be resuscitated? Do you not want to be resuscitated? Do you want music in the room while you're dying? Do you not? So all of these things will help everyone prepare themselves. So education, education, education is the first thing you can do to help facilitate a peaceful death. No one knows what death actually looks like because when it's depicted in the movies or TV, it's false. It's wrapped up in a pretty little bow and it's not accurate. I think it's so important that we really see what it looks like when someone is actively dying, not in pain, just going through the natural process of the body shutting down so we can prepare ourselves. The more we know, the less we fear. So that is why I'm showing you these videos. I will give you a trigger warning when I'm going to show you. And these are not my patients. These are sent to me by followers of mine, and I'm given permission from them to show these videos. So actively dying. You've seen in my other videos talk about actively dying, which is the last phase of life. Most everybody in this actively dying phase will look a certain way. And these videos are going to show you great examples of what I'm talking about. So this first video I'm going to show you, and again, I'll give you a trigger warning before I do. You're going to see what it looks like to have the changes in breathing that I always talk about during the actively dying phase. So this person is fully unconscious. They did die within a few hours of this video, per what the family told me. And it's a great example of hearing terminal secretions and seeing the changes in breathing. So trigger warning, here is the video. That was truly a perfect example of what someone would look like at the end of life during the actively dying phase. You could see that her family was moistening her lips with a sponge. Perfect. You never want to force food or water, but it's great to moisten the lips or moisten the mouth with some kind of sponge and water. So that was perfect. You could hear a little bit of the terminal secretions, which is very, very normal and not disturbing her. How do you know? Because you can see her face. She looks calm. She doesn't look bothered by it. And you can tell that her breathing is a little different than regular breathing. Also very normal, and she looks very relaxed. So thank you so much for the video. So this next video is with the same woman, and you're going to see a great example of the changes in breathing, much different than the first video. What you'll notice is there's going to be long pauses between each breath. So much so that you think she's maybe not going to breathe again, but she does. And I show you this because that's super common, super normal, and it's okay. You would let the body be the guide. The other thing you might notice is, again, the terminal secretions, or AKA the death rattle. Again, very normal. I've done other videos about this. It's to be expected at the end of life, and you can see in her face, she is not bothered by it. So, trigger warning, here is the next video.
Struggling.
Okay, so that was a perfect example of the changes in breathing. You did hear some moaning during that video. If I was the hospice nurse, I wouldn't say that woman was in pain because it was a rhythmic moaning. A lot of times people at the end of life will have like this rhythmic moan, or even not even moan, but like a noise. And if it's rhythmic, it's usually just like a self-soothing kind of mechanism that a lot of people, a lot of bodies will have at the end of life. You could always err on the side of maybe it's from pain so you can give medication, but usually it's not, and it's just the body's way of self-soothing. Okay, so this last video, the most important one, I think, because it shows a perfect example of agonal breathing. Agonal breathing is not a true breath. It is something that happens at the very, very end of life. It can look scary. It can look like the person is a fish out of water breathing or suffocating, but it is not. It's the most natural and the most normal thing to happen at the end of life because it's a bodily reflex that happens in humans at the end of life, and it's a perfect example of it. And you can see by the look on her face that she is very relaxed. So trigger warning, here is the video. So what you just saw was a perfectly normal thing to happen at the end of life. I say this because I think people usually would see something like that. They would see agonal breathing and they would think their loved one was suffering, they needed to do something, and that's not the case. This is a very normal breath that will happen at the end of life. Thank you so much for being willing to watch these videos with me. I think it's so important that we educate the general public of what death actually looks like. The more we normalize this, the more we prepare ourselves, the more at ease we can be during these stressful times.